So with that, I guess we can get started.
Need to unmute myself. Welcome everyone, and thank you for coming to our presentation today on mental health awareness. We're going to talk about sort of mental health in the context of post-secondary, as well as one of our programs, Empower Me. So to start off, my name is Dr. Elizabeth Cawley. As Amanda mentioned, I'm the director for the National Mental Health Strategy at Studentcare. I did my PhD at McGill University, and I studied specifically post-secondary student mental health. It's really unique in a lot of ways. So if you have questions related to student mental health, please feel free to put them in the chat and Amanda will ask me at the end. So to get started, I think it's a really good place to start with what is mental health? Because we often have sort of an unclear idea of what this is. So when you hear the phrase mental health, the first thing that normally pops into your mind are the, diagnoses, depression, anxiety, PTSD, and so on. So when we hear the phrase mental health, we're often thinking of mental illness. And these terms are often used interchangeably. So you'll say, I have mental health, when in fact, what you really mean is that you have a mental illness. Or they're considered sort of opposite ends of the spectrum, and they're very different from one another, suggesting that if you aren't mentally healthy, then you have a mental illness. But the World Health Organization in 2006 actually put out this definition, which says that mental health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. And so not merely having a mental illness does not necessarily mean that you are mentally healthy. And so this model we know is actually incorrect. And they're not necessarily opposites of one another, and they're not the same thing. So a better way to conceptualize it is this model put out by Corey Keyes in the US, because mental health changes across your lifespan. And because it exists despite the presence or absence of mental illness, a clearer way to think about mental health is to consider sort of these two dimensions. And this model suggests that mental health and mental illness are not opposites on the same spectrum, but they're related and interactive states. So an individual can experience symptoms of serious mental illness to no symptoms of mental illness on one of the axes, and then high mental health or low mental health. And so here, mental health is really having coping skills, having resilience, taking care of yourself, and really the ability to flourish. And so the example I like to use is actually a personal one. I was diagnosed with anxiety when I was in my post-secondary studies. And so I would qualify as having high mental illness on this spectrum. However, I've put a lot of time and energy into coping skills and developing ways to manage this to the point that I really seem to have it under control. So I would have high mental health, but also high mental illness. So I would fall into the category of flourishing with a mental illness. So as you can see, they're interactive states. So why focus on mental health at all? Well, 75% of people who receive a mental health diagnosis are first diagnosed between the ages of 16 and 24. And this is really interesting for post-secondary students because this is typically the age range of most undergraduate students. So when you're receiving sort of your first diagnosis, you're in this age category. And Canada has over 2 million post-secondary students. So that's a lot of students that are first sort of exhibiting signs and symptoms, which means that we need to have mentally healthy environments. So we need to have a campus community where students can maximize their ability. And this means not just having support sort of in the traditional sense in a counseling center, but thinking about healthy classrooms, healthy pedagogy, different ways of supporting students, and not just thinking about it in sort of that traditional sense. And that's why post-secondary institutions have incredible and unique opportunities for communication and intervention. There's really no other time in your life where you sort of live, work, play, enjoy extracurriculars, all within the same environment. So if we can maximize that environment to support student mental health and well-being, then we can really make a significant impact. And as I mentioned, the people at the highest risk for mental illness and as well as substance dependence is 16 to 24. And we know that 1 in 5 students are diagnosed or treated within the last year that have sort of a mental health or mental mental health problem or mental illness, and it has significant impact on your academics. So conditions experienced by most students were stress, anxiety, issues with sleep, and depression. And the vast majority of students report that this has a significant impact on their ability to participate in post-secondary environment. And a really startling statistic is that 90% of students report feeling so overwhelmed by all they have to do in the last year that it's actually difficult to function. So almost 100% of students are feeling this way. Despite the large numbers of post-secondary students with mental illness, many choose not to seek professional help, and there are a variety of reasons for that. But generally, we know that of those students that should be getting mental health treatment, fewer than 50% who are struggling are actually getting it. And post-secondary students, for a number of reasons, may be at particular risk, even compared to your non-post-secondary attending peers. And that's because of issues such as financial pressures. It can be very expensive to go off, live on your own, pay for post-secondary education. There's often a flux in personal relationships. So leaving friends, making new friends, as well as the academic pressures. And these can all exacerbate sort of the stress and feelings of overwhelmed. And then that sort of feeling of beginning this new stage of life. And as I mentioned, fewer than 50% of students who need mental health support are actually getting it. And a lot of people think that the reason for this is stigma, but we know that that's not actually true for post-secondary students. And most students say that if I was experiencing a mental health problem, I would seek out support. So what are those reasons? Well, the top 3 reasons for not getting help, the first one is actually it's normal. People think that what they're experiencing is normal. And that's because you're normally comparing how you're doing to your peers. So if you know somebody is staying in the library all night, not eating, not sleeping, feeling really overwhelmed, high levels of anxiety, if you see this in your peers, you tend to normalize this and you think that what you're experiencing is normal, when in fact it could be the early signs of a mental illness or mental health problem. The second reason is it'll go away on its own. And this sort of has to do with the normalization as well. That you think that this is normal in post-secondary education, once I get through this year, it'll go away, it's not a big deal. And the problem with that is that the longer that you wait to seek out support, normally the more difficult it is to treat and the more severe the issue becomes. So for example, the amount of time between first exhibiting symptoms of depression to actually getting professional support for it is 8.5 years. And you can only imagine the impact that that would have on your life, that significant period of time. And so getting help early on is extremely beneficial. And the third reason is I don't have time. And that can normally be because as you're developing these signs, if you're not sleeping, if you're not eating, it can be really difficult to engage with your academics. And so if you actually make time to get professional support, it can actually be easier to engage with all the things that you'd like to. So mental health in the context of the pandemic, because this is definitely a semester and a year unlike any other. Students are going to school in a brand new way, in a way that we've never experienced before, with stressors that are incredibly difficult. So here are some things that we've noticed. So obviously there's an adaptation to this new method of studying and working. You're not in a classroom, you're not engaging with your peers and your professor in the same way. And so it can be difficult to feel organized or focused because you're doing it at home or in your bedroom. It's just not the same experience, and it can bring up a lot of issues or a lot of feelings of stress and anxiety. As I mentioned, there's that loss of social contact. So, we didn't have frosh or clubs night or all of these opportunities that students normally have to engage with others. And so there's feelings of isolation, and feeling this way is normal in what the difficult period that we're going through, but can also be really challenging. And then the division between work and leisure. If you're going to school, sitting at your computer, And then you're also going and sleeping in the same bedroom, having those borders or that differentiation between going to school and leisure can be really difficult, and it can have a really detrimental impact on your mental health. The borders are less clear, and it's leading to fatigue and a lost sense of productivity, and has a lot of difficulty with relaxation. They say don't put your phone in your room, don't put your computer in your room, but if that's the only place you have to study, it can be really challenging. And then just the context of the uncertainty. We don't know how long this is going to go on for. We don't know if, next year post-secondary will return to normal and you get to go back to your classroom. So there's a lot of stress, anxiety, and then there's also a lot of grief. Students are reporting really high levels of grief. There's actually a sadness for a loss of this time, of this experience, of what you signed up for to go to school. Normally it's not just supposed to be academics, but there's a loss of all of those other things that, really make post-secondary education so much fun. So here are some signs and symptoms to look out for. And I'd like to just point out that, not just one of these means that you have a mental illness, but it's really a combination of things. And this is certainly not a comprehensive list. These are just some things to look out for. So if you notice that, a couple of these resonate with you, it might be willing to get it checked out and speak to a professional. So loss of interest in things that one normally enjoys, a loss of motivation. If you really like taking your dog for a walk and you're just not feeling like it anymore, or you like speaking to friends and you're becoming more isolated, those can be an early warning signs. And then difficulties with managing daily activities. So in this case, it would be, going to school or making lunch, things that, you could do pretty naturally. Now, if you find that you're dragging yourself out to do them or having a really hard time, again, can be an early warning sign. And then significant trouble sleeping. So either constant fatigue, if you're feeling tired all the time, if you're sleeping all the time, or if you're not sleeping at all, insomnia, as well as this fatigue, again, can be an early warning sign. And then something that we know from the literature, there has been reports of significant increase in alcohol and drug use sort of across the board. But if you're using it in an unhealthy way, this might be something that you want to talk to somebody about. Then irritability, anger, increase in conflicts with friends and family. If you find yourself just really irritable, and then say on top of that, you're not sleeping, you're not eating, again, in combination, these can be warning signs that you should speak to somebody. And then I think most critically is a loss of hope for a future. The feeling of hopelessness is one that is really a very significant warning sign. If you're feeling that, that feeling of hopelessness, absolutely reach out to a professional to speak about that. And so I'd like to talk a little bit about the Empower Me program by Studentcare, which is a mental health and well-being resource. And I think this program is really beneficial because we know that young people, students included, really like using e-mental health technology or technology in general to talk about their mental health. Students report that they are more willing to open up about what they're experiencing online or using technology to do that. And so this is a program that facilitates that. So what is Empower Me? Empower Me is a mental health and wellness service that seeks to contribute to a resilient student community by supporting existing on-campus mental health services. So we're not a replacement to what's available on campus, and if that's where you feel comfortable accessing support, please do. A lot of campuses are still offering virtual counseling, but we're available beyond sort of those 9 to 5 hours. A lot of counseling centers operate in traditional sort of office hours, 9 to 5, but we're available 24/7, 365 days a year. So if you're struggling and it's 8 p.m. at night, you can absolutely call the Empower Me number and access support. We're also confidential and multilingual. So our call center is in French and English, but we can also offer support in a variety of languages. So if English or French is not your first language and you'd like to reach out for support in a different language, we can help facilitate that. We're also culturally sensitive, gender inclusive, and faith inclusive. So we're trying to be as open and supportive to a broad range of students. And you can connect with the Empower Me professionals via a mobile app. We have an app where not only can you connect with a professional, but you can also read about a multitude of different topics. So if you just want to learn more about anxiety or depression or stress or nutrition, healthy eating, healthy sleeping habits, all of that information is available on the app for you to read at your leisure. And then you can connect with professionals via the phone, via video conferencing, and when we're not in a pandemic, you can see your counselor or professional in person as well. And our philosophy is that no issue is too big or too small. Again, a lot of students feel that what they're experiencing doesn't warrant professional support. I want to reiterate that it always is. If you feel that something isn't okay, please reach out. Just as you wouldn't let something go with your physical health. For example, if you had a pain in your leg for 2 weeks, you probably wouldn't wait those 8.5 years before getting it checked out. It's always better to reach out for support and just see if everything is okay. So we can deal with everything from stress and anxiety, depression, breakups or relationship issues, family responsibilities, substance use, as well as misuse, disordered eating, which we know is really high amongst post-secondary students, but also just time management, career counseling. If you're concerned about, entering the workforce in your last year and you want to talk to somebody about that, as well as financial planning and financial insecurity, nutrition, and more. Again, this is not an exhaustive list, and our philosophy is no issue is too big or too small to reach out to the Empowerment Program. So I will end it there and see if there are any questions.